So like I said, I'm going to trim the very beginning of the video once it gets posted to YouTube, so that we can show a perfectly trimmed recording when people go back to view it later. So this is live right now. All right, ready?
Yeah.
All right. Welcome, everyone. Thank you for viewing. Today our topic is the Patient Protection and Affordable Care Act. This is judged by many to be one of the most significant overhauls to the health system in the United States since Medicare and Medicaid in 1965. So with me today we have Johnny Laurent, VP and General Manager of Sage Employer Solutions. Johnny is definitely an expert in this area. We're going to spend a couple of minutes today talking about PPACA, as it's commonly known by its acronym, the Patient Protection and Affordable Care Act. So, Johnny, the question to you is, if I'm a small business owner or a medium-sized business owner or an employee, what kind of an impact does PPACA have on me or my company?
Well, thanks, Greg. Thanks for inviting me to talk, and it's really great to get to talk about this because studies are showing that probably about 42% of workers out there still don't realize that the Affordable Care Act is the law of the land. There's 49% of the public that are saying there's not enough information about it, and it's interesting that, as you said, such a large, impactful legislation since 1965 on benefits and health care, it really impacts not only those small and medium-sized businesses, it really impacts all businesses, and even more than that, it impacts every employee. One of the things about the Affordable Care Act is that it really begins to put the ownership of your health care into your hands as an employee, as an individual, and now you have to make decisions on what you're going to do and how your money is going to be spent and how you're going to get care. And that's pretty, that's a big change. I mean, some individuals have done that for many years, right? They don't accept health insurance or their company doesn't offer it. They have to figure out how they're going to do that on their own. But a vast majority of our employees around the world, or around the country, sorry, they usually rely on their employer. It's interesting, an Aflac Workforces report showed that 89% of employees admitted to just selecting the same benefits they had the year before, right? And I have to raise my hand and admit, I do that all the time. I'm happy with what I got. I don't need to look at everything. I'm just going to keep doing what I've been doing. And that's sad in one part because companies have spent a lot of time, and insurance companies have spent a lot of time in enhancing some of the things that they do, and we lose out on some of those benefits. But this legislation really forces us to make decisions about our health care. First of all, it makes companies decide what they're going to do. It's interesting, this has been started since 2010, and as we're going along, each little piece of this legislation begins to come to fruition. This year, ending of 2012, beginning of 2013, we began to have to report health insurance benefits on your W-2. You may or may not have noticed it on your W-2, but that was a big change for employers with 250 or more employees. It's one of the small changes that are going to happen. And in as we get closer to 2014, there are some changes that are going to be pretty impactful to businesses and owners of businesses regarding healthcare that they really need to begin to be thinking about now.
So as let's say as a customer of Sage, for example, clearly based on the sign behind me, I'm an employee of Sage. But as a customer of Sage, what can I expect you to do to help me to guide me along through this process on out into 2014, 2015, et cetera?
That's great. I'm glad you asked that question. We've got a strategy in place, really three-pronged strategy. One is information. We need to make sure that we're providing you with great information. The second one is personalizing that information. And the third is preparing you to act on that information and the personalization of that information. So really, if you go anywhere today, if you Google Obamacare or PPACA or Affordable Care Act or whatever, you're going to get tons of information. And everybody's feeding you information. As a consumer, you have to know that the source is going to be there and is going to be up to date. The law is changing daily. Maybe not the law, but how it's going to be implemented is changing daily. There's a lot of talk about the health exchanges where individuals can get insurance if their company doesn't own it. And these are state, public, and private exchanges. Well, that was supposed to be implemented in 2013, and employers were supposed to be able to or had to notify employees of these exchanges. Well, they're behind. And so that went from January 1 of 2013 to the fall of 2013. And as we look at the exchanges in which states have begun that process, it's not ready to go, right? It's getting close, but it's not ready to go. And so gathering that information is pretty important, and making sure that you have it up to date. Around January 1st, there was this new, when the legislature was trying to get all the laws out on December 31st, they were changing things constantly. And some of our partners that work with us on getting this information, they were up at all hours of the night trying to get, real world, real English explanations of what the legislature was doing. So we really want to provide information. We're going to do that in a couple of ways. Of course, our website. We already have, excuse me, a website that provides information about PPACA, some checklist, some white papers and things like that. But I think the coolest thing that we're doing is we're along with Sage Summit, because Sage Summit, we believe this is such an important topic that we've actually carved out a special day just to work with PPACA, to create a special track to talk about all of the things that the employers need to do and to think about with PPACA.
So if I want to spend 3 or 4 days at Sage Summit as a customer of Sage, I can sign up then for a day that's exclusive to PPACA, sort of an independent learning track outside of the other events?
Absolutely. There's an education track where we're going to have a guest speaker in the morning, and that guest speaker is a well-known expert on PPACA, really to break down the law. What does it mean? What's it look like? Bipartisan, just really, here's what it is. After that session, we then are going to go into 2 breakouts and really begin to start digging into more of the detail of what was talked about. There's things coming up like pay or play. There's talk about part-time or full-time employees. If I'm under 50 employees, do I have to worry about this? One of the interesting things that I've learned recently is I may own multiple companies with different FEINs, but if I am the majority owner of those multiple companies and the total number of employees I have over all of my companies is greater than 50, it does impact me, even though each individual one may be less. So we can't just go, oh, yeah, I'm less than 50 and I don't have to worry about this. We really need to dig into the details. So that's the morning session. The afternoon, we have a gentleman coming in that works with benefit brokers and with insurance carriers. They do a lot of work. Helping people understand their benefit packages and so forth. He's going to be moderating a panel discussion with insurance carriers. So we're going to actually have, so in the morning we have the government side and the law, and then we're going to have some insurance carriers there talking about how they're approaching the whole act and how they're going to give employers the options that they need. So you'll have health exchanges, you'll have insurance carriers. We'll be able to break down and look at all of that. And in the afternoon, we'll have 2 more sessions, breakout sessions, where we'll really start to dig on all of this topic. The first one, looking at it from an employer's perspective, and the second one, really looking at it from the employee perspective. And Greg, that's, for me, here at Employer Solutions, we always talk about our return on employee investment and making sure our employees stay engaged. And I have to say, out of all of this stuff, this is the one place that as a business owner, I would be the most afraid. And that's because if our employees are not engaged because they're worried about this healthcare thing, I lose productivity, which is going to make my business suffer. That Aflac Workforces report that I mentioned earlier, they talked to U.S. workers, and 72% of the U.S. workers did not recognize the phrase consumer-driven health plans. ACA, or PPACA, is all about consumer-driven health plans. They were asked, don't you want more control? Don't you want to take more control? And 54% of them said, no, I really don't want more control over my health care. But I think the biggest shocker to me and to business owners, I think I want to raise an important point. 75% of the workers said that they expect that their company to provide them the data they need to know to make the best choices. If you look at the respondents of employers in that same survey, 13% of them said that it was it was not their priority to educate their employees. That's a huge difference. And it really bothers me to a degree, because what I'm worried about is that employees will look differently at their company because they're not helping them get educated. So one of the great things that we're going to do here at Sage is we're going to not only help companies decide what they need to do as a company, but we're going to provide tools and resources to that company to help educate their employees. Because to me, that's what's really all about. It's we need to get it not just to the employer, but all the way through to the employee.
Yeah, and one of the cornerstones of this style of communication very early on in the process is this day-long track that you referred to during Sage Summit.
Yeah, absolutely.
Yeah.
If people are coming to Sage Summit for the great technical experience they're going to have for Sage City, for all this great stuff, they also need to think about this education track around PPACA. It may be worth grabbing another person from the company who's responsible for that and bringing them along just for that day. We're actually going to have a couple more sessions the next day that are within my business unit just talking about it again. It's that important. And you're not going to find this much information that can be tailored and personalized to you anywhere else. I mean, you look at the HR conferences going on, the payroll conferences going on right now. They have small sessions about it, but not this comprehensive of a look at it. And I'm really excited about doing this and the people we've got coming. I think it's going to be a big benefit to our customers.
Excellent. So let's close out the conversation at this point. I want to ask you one question to help you summarize for our audience and those that watch this video afterwards. The Patient Protection and Affordable Care Act, PPACA, healthcare reform, Obamacare, however it's referred to, is certainly significant. I think we've established that, yeah. And I'm not entirely sure we needed to establish it today during our video conversation even, right? What is the one thing that small business, medium-sized business owners and their employees should be doing today to help them prepare for the changes that are coming?
Yeah, I wish there was one thing I could say, right?
Yeah.
But I think the best thing to say is to get informed. They need to understand what's going on. You can't have your head in the sand anymore. A lot of people wanted to just ignore it and say, somebody else will help me with it. That may be true, but it's time for them to take some ownership in it. From an employer standpoint, they need to begin looking at their health plans. Do they fit into the criteria of PPACA? Are they affordable health care? They need to know, are they going to pay or play with this act? So those are some things that we can help them with. But then they need to start also talking to their employees about, it's not wait till the end of the year, here's a new health plan. They need to talk to their employees now. And they need to realize that this is not a one-time fix either. This is going to be an ongoing thing. So I guess the best thing is get informed now.
Yeah.
But don't just take any information. Make sure it's relevant to your business and you understand it. And that's where I hope we can come alongside of our customers at Sage Summit and even before, and really help them start to understand how to decipher all of that information that's out there, weed through it, make it personal to them, and then apply that so that they can make actions and take actions with their employees as well.
Excellent. So I've certainly learned something today, and I think I'm going to go out there and get informed, as you had said. It seems to be the most important thing I can do. Thank you very much for your time today.
Absolutely, Greg. It was fun. It was really fun, and I look forward to seeing you at Summit.
Most certainly. And so to close out the conversation for our viewers, sagesummit.com is where you can go to find more information about Sage Summit, our partner and customer conference. This year it's in Washington, D.C., July 21st through the 26th, and early bird registration is currently open. Johnny, again, thank you very much for your time today, and I also look forward to seeing you at Sage Summit.
All right. Thanks, Greg. Bye-bye.